I'm Jackie Luke-Sneeve with the Surgical Review Corporation, and you're watching the Weight Loss Surgery Channel.
Welcome to Weight Loss Surgery News. I'm your host, Leslie Thompson, and thank you for joining us today. In this week's news, we'll look at what obesity is doing to America's baby boomers, and then see what it may do to healthcare costs by the year 2018. And we'll find out about a new study linking obesity and cases of Barrett's esophagus in women. But first, this weekend, a group of weight loss surgery patients from the Gastric Band Institute in Las Vegas will be hitting the streets for a mini marathon and demonstrate just what a difference bariatric surgery can make. They call themselves Team GBI, and they'll be participating in a 13-mile run-walk during the Las Vegas Rock and Roll Marathon on Sunday, December 6th. Now, these patients have been training hard with the Institute's dietitian, Prudence Tickner, who has also been using a blog to advise them about nutrition and training for a half marathon as properly as possible.
We've been training for 4 months. The training consisted of people training 2 to 3 times a week during their walk runs, and then 1 cross-training day. And then we would do what we call our long runs together. And we offered group trainings on Thursday evenings and Sunday mornings. And they started at 4 miles, and we've trained all the way up to 10 miles being our longest run. There's also the psychological and the mental training, because it takes a lot of focus and a lot of determination to stick with a training for 4 to 6 months before you ever get to the race. So we at GBI, we sent out blogs and motivational tips between 2 and 3 times a week for the 4 months that we've been doing it. And what I did was think about possible barriers or discouragements that may come up, and I addressed those throughout the months.
All of us here at the Weight Loss Surgery Channel want to congratulate Team GBI for their commitment to healthy living, and we wish them lots of luck this weekend. Meanwhile, a new study indicates that obesity could become a major cause of disability among today's baby boomers. Researchers from the University of California recently used survey information to compare disability rates among people in their 60s from 2 different time periods. They found that the group in the more recent time period had higher obesity rates and were far more likely to have problems walking or even getting out of bed. Now, obesity can have a direct negative effect on joints and the cardiovascular system, and both of these problems can render an older person disabled. The study also compared people in their 70s and 80s between the same 2 time periods, but didn't show an increase in their disability rates. Researchers did not pinpoint the exact reason why obesity and disability were higher among the new generation of people in their 60s, but study author Teresa Seaman said the information shows that a 20-year trend of older people functioning better than ever before could be ending soon. It's time for a quick break. When we come back, we'll show what the national expense for health care may be by 2018, along with the obesity rates that raise prices, and fill you in on a fine way to reduce the risk of prostate cancer. We'll be right back.
The Weight Loss Surgery Channel is proud to partner with RenewedReflections.com for weight loss surgery support. Share encouragement, strength, and hope with new friends online. And get the skinny on different weight loss surgery procedures from a resource you can trust. All at RenewedReflections.com.